to move. There we go. So we have norms for virtual meetings, our partnership, and questions and answers. We are recording this meeting. If you can mute your microphone in the meantime, if you have a question, feel free to raise your hand or type it in the box, and that way we know that you're present and you're able to participate. And we're going to give it to Carolina now to go ahead and present. Oh, sorry, Carolina.
That's okay. Hi, good afternoon. Thank you for inviting us, Maritza and Letty, for having us again. We love the Aztecs, so thank you for having us today. I am joined by my colleague Araceli Navarro. She's the Director of Governmental Relations in the Children's Partnership, and Araceli and I work. So I work for the County Office of Education, so the same as Maritza and as Betty, and we like my program specifically, it's the Immigrant Relations Program. So on the next slide, you can see a little bit about what the Immigrant Relations Program does at LACO, and it's mostly to safeguard the right of education for all students, regardless of their immigration status, and to ensure that schools are safe and welcoming learning environments. And part of the job I do there is to provide technical assistance and capacity building to the school. So normally I train teachers, counselors, school staff on issues that have to do with immigration. But through this COVID time, and also because I come from the nonprofit sector, I've been meeting much more with families. And I love meeting with families, and I really appreciate the time that you give us out of like your very, very packed day. So I just wanted to start with that, and I'll let Araceli talk about her agency.
Hi, good afternoon. I'm with the Children's Partnership, and we're a statewide children's advocacy organization based in Los Angeles. And I think for us, what's really important is partnership. So I'm really happy to be here with Carolina and the work that we've been doing together around children and immigrant families. We really think about the community engagement component and really translating that into policy solutions and systems change at the state and federal level. So we're happy to be here. Thank you.
And in the next slide, we wanted you to know, how the two of us met. So through this coalition that it's called the Protecting Immigrant Families Coalition. So it's a big army of agencies in the state. So it's a national coalition, but then these are the agencies within the state of California that it's like the smaller chapter of this coalition. So that for you to know how many out there are fighting for immigrants' rights and for immigrant justice, so that you're not alone. And also this presentation is a product of that collaboration. So like the slides that you're seeing were produced by them, adjusted tweaked a little bit by us, but yeah. So hope you enjoy them. And with the next slide, I want to start by saying that what are the values that bring us here today, right? So it's like to make sure that you know that healthcare is it's a human right. So it doesn't matter where you come from. So like, and it doesn't matter your gender, your sexual orientation. It doesn't matter where you were born. So it is important for us also to know that you are valued and that you deserve the right to healthcare. Also, for social justice action. So like we try to encourage you, and I think it's beautiful that on a Thursday afternoon, while you could be, with your children or like preparing so many things at home or taking care of other family members, you chose to be here, to be informed, so that then you can go out and share this information with others. So like that's part of what community means, that it's like taking care of ourselves but also taking care of others. The next slide, please. So for today, we have quite an ambitious agenda, but we wanted to talk about, the healthcare system, also access to food, and then the importance of staying healthy and during, these COVID times. So we'll start with the healthcare system in California. And Araceli will go more in depth into the different programs, but I just wanted to start by saying that, living in California, it's a privilege for a lot of us, for everybody, I would say. If you talk to friends and families in other states, they're not so lucky that the state provides, and also in LA County specifically, it's ensuring that everybody has access to medical services. So in LA County specifically, it doesn't matter your immigration status, your age. Like if you are not covered by the state Medicare program, then you can be covered by the county. But Araceli will talk about that. But because of COVID, a lot of people lost their job or saw their hours reduced and their income impacted. So it is, it is important to start by saying that if you qualify for these programs, you shouldn't be ashamed to access them. That the fact that you go out and apply for these programs doesn't mean that your information is going to be shared with other agencies. It will not be shared, with your landlord. It will not be shared with Homeland Security. Like if you go and apply for certain programs, that information remains confidential. It doesn't matter who's the president to begin with. So even as much as you hear with the negative rhetoric, like you are, your information has to be protected. Then also, you don't have to share your immigration status if you yourself are not applying for the benefits. So if you're applying for food stamps, let's say for your children, they don't need to ask for and you don't need to disclose that you are undocumented if that was the case. So, and you should not let your immigration status be a barrier for you to access healthcare. And then the next slide, please. So the state of California developed this guide for immigrant Californians. So it doesn't talk about, California residents. It talks about immigrant Californians with them in mind, with us in mind, on what specific needs we may have. So am I being evicted, or am I in risk of being evicted? Is there an eviction moratorium? What do I do if I lose my job? Can I apply for unemployment? So a lot of questions can be answered by accessing this guide. I put the picture here of the Spanish version, but it's available in English, and if I remember correctly, it might be in other languages as well. But we can put that in the chat for you as well, so that you have it. So that's like super valuable. In addition to that, I wanted to start also by talking about access to COVID testing and to medical treatment, and how, because of this time of emergency, and if we go, if you back up a little bit, because of this time of emergency, I jumped over. Yes, because of this time of emergency, so it's important to know that accessing testing or treatment because of COVID will not be considered against your immigration status. So that's one place where we should start. So acknowledging that. So the next slide talks about like the 3 different type of healthcare programs that are available. So and Araceli, this is your slide, so I'll let you take over here.
No problem. Thank you. Yeah, so I just wanted to let you all know that as Carolina mentioned, there are a variation of health coverage options. There's the public, private, and employer. Here, you'll see that often at the federal level, it's referred to as Medicare and Medicaid. Here in California, it's MEDI-CAL, and we'll talk a little bit further about that. Private insurance is for anyone who can pay for a plan. So that is what's referred to as the Affordable Care Act, or in more layman terms, the Obamacare. Here in California, our federal exchange, we chose to create our own program, and that was Covered California, whereas in other states, the federal government oversees their plans. There's also the option of the employer coverage, and this is where the employer offers a health plan through their job to individuals and sometimes their dependents. Next slide, please. Oh, so I think this is where I think we might have some order of our slides here, just based on the Spanish one. But I think these are some of the slides that Carolina was referring to in knowing your privacy rights, and especially right now with COVID continuing to increase, the cases continuing to increase across the country and in California and specific counties. We really want to highlight here that you can find a COVID location. There's also the county has created pop-up places. So I know that Dodger Stadium has been one of the central locations where people can drive up and get a test. You can also go on LA County's website, and they offer pop-ups. And those are at locations like a supermarket or a community center, a parking lot. I personally went to one in Boyle Heights. And so there really is opportunities where you can schedule to drop by and get a test. And also the Department of Public Health offers updates in real time, in addition to the governor's press events that happen every day at noon. Next slide, please. This is also the second part of the protection of information and access to both testing and treatment as a result of a positive COVID test. So what you'll see here in the orange box I want to highlight is that the United States UCSIS, the Department of Homeland Security, has early on said that treatment and or testing for COVID will not be used against you, regardless of income or immigration status. And so really recognizing COVID as a public health issue and not a political one. So we want to just emphasize here that it really is about public and community health. And if you have questions and or need resources, both the state has a landing page around COVID-19 in multiple languages, and or the links that were shared in the chat. Next slide, please. It's not changing on my end.
Yeah, it's not. While we see the next slide.
No, I'm sorry.
It's to tell you, that there are different sites. We just put in the chat box the LA County address, like the site locator, and also the one for special events. And the two slides that you just saw that went by are for the center that it's operated by the Department of Public Health at the Consulate of Mexico in Los Angeles. So if you know, and this is not just for Mexican nationals, I should say this is available to everybody. So they are open Wednesday to Sunday, and they give approximately 250, 300 appointments every day. You can also do walk-ins, but it's recommended to use a phone number to make an appointment if possible for your convenience. So that's a very good location to go to, like maybe not as close for if you're in Azusa, but if you work near downtown, it's a very convenient location. And then the next slide. Okay, so Araceli, back to you.
Great. So I mentioned to you the three different types of health coverage. The private health plan is under the Affordable Care Act, and this was, again, as referenced as Obamacare. Unfortunately, undocumented people and DACA recipients are not eligible for the Affordable Care Act exchange, but I did want to recognize what it does require in terms of coverage for those who are eligible, and also the subsidies that are available as a result of being able to qualify for a plan. So there is one of the big pieces around moving the Affordable Care Act forward was to make sure it was affordable. Granted, there still continues to be issues, but it is in comparison to what families are paying over $100,000 for a treatment, it's now capped at a X percentage. And so it really has alleviated some of the costly medical debt that was in place before. Next slide, please. So the next one is our public health plan, and this is what I refer to as the Medicaid program at a federal level for low-income individuals. And I think what we want to make sure to differentiate between the federal and the state is that Medicaid at the federal level does not cover undocumented individuals, only qualified immigrants. However, as you'll see when I get to the MEDI-CAL slide, you'll see that we in California have prioritized, and as Carolina mentioned at the beginning, in terms of our values and justice around health access as a right. We really have invested in California to expand the populations that are covered by our MEDI-CAL program. So we can go on to the next slide. Here we can talk about Covered California. As I mentioned, this is what's considered the exchange program for California. So sometimes on national news, for example, you'll hear the federal exchange, or they'll change regulations. And California, because we chose to manage our own program through Covered California, they will monitor some of the things that are happening at the federal level, but they don't have to comply in the same way because we're managing it on our own. And so here you can go through coveredca.com. I think one of the things as it relates to our MEDI-CAL program is in California, the online portal is through Covered California, and depending on your eligibility on the back end, it moves you to whether it's Covered California or MEDI-CAL. And so what's important for us as advocates is to make sure that you, from the consumer and beneficiary side, feel really good about navigating these portals. So as you get on those websites, or you seek assistance, please let us know how we can better improve the navigation of these programs. We work with different work groups to make sure it's accessible to all of you, and you're able to understand what it means through these different portals. Next slide, please. So now we get to MEDI-CAL. So MEDI-CAL is our public health program here in California. As I mentioned, we've invested a lot of general fund dollars from our budget for expansion of health coverage. So for example, in 2016, we expanded health coverage of children regardless of immigration status to a full scope MEDI-CAL up to the age of 19. And last year we expanded MEDI-CAL for young adults up to the age of 26. One of the big things we were looking forward to doing was expanding coverage to seniors, regardless of immigration status as well, into MEDI-CAL. But as a result of COVID mid-year last year, a lot of the advocacy had to stall, and now in January, we're looking forward to some advocacy around coverage, just recognizing the health implications that not having access to continuity of care for individuals, it makes a difference in access points. Next slide, please. So just want to remind everybody around the programs, the services available, and who qualifies for all of these programs. One thing, we recognize that undocumented adults over the age of 26 still remain uninsured in a full scope MEDI-CAL. There is emergency MEDI-CAL, but we want to make sure that you all see here what it means to have access to full scope MEDI-CAL in terms of medical, preventative, mental health, especially for a lot of youth and school-age children, the social isolation that's happening as a result of not being in a school setting. We are working to make sure that children have access to these services, and also recognizing that teachers and parents also need the support. So that will continue to be part of our advocacy, but want to make sure that you all know that for now, this continues to be something that is available to children. Next slide, please. So what does that, what does that look like? Yes. So really looking at the family size and based on federal poverty levels. Every year, we look to the federal government, who puts out new guidance and information through our resources that we'll share at the end. We have a one-pager which offers information around every year that's revised and made available to all of you in multiple languages to make sure that that you understand what it means to qualify and what you have access to. So the two qualifiers are immigration status and eligibility, and this is based on income reflected here for this year. Next slide, please. So as I mentioned, individuals over the age of 26 do have more challenges as it relates to statewide or federal access to full scope MEDI-CAL. Fortunately, many of our counties have taken on what's called indigent care programs at the county level to support emergency services, health coverage, not as an insurance, but still access points for individuals to get the care they need. So for example, in LA, it's the My Health LA program. And there is also over 170 community clinics across the LA County area that offer services from primary care to dental to mental and behavioral and other specialty care programs. So we wanted to offer you their website here to remind you all to check out the closest health clinic nearest you. Of course, with what's happening right now around COVID, they're all changing their models in terms of in-person visits, just in terms of amount of people coming in, but want to make sure that you all know that you can get a telephonic or a telehealth visit via video with the primary care provider and or questions with other enrollers on seeking coverage. Next slide, please.
So
Great.
I can introduce Mariam Shaye, my dear colleague, and she's the nutrition program manager at LACO, and she's joined us. And I failed to thank her at the beginning because she's also been part of the Protecting Immigrant Families Coalition and a very important presenter for you today. So Mariam, all yours.
Thank you so much. Can you hear me okay? Okay, great. Thank you so much. I really appreciate this opportunity. I, like Carolina, really enjoy speaking with parents. So after this meeting, please feel free to reach out to me if I can be a resource to you. I recognize that our families are really the most powerful agents of change, and they play such a fundamental role in transforming the lives of our children and communities. But we have to recognize the existing disparities and gaps that make it really difficult for our families to do their job, especially our immigrant families. And this is where our educational agencies play such a critical role to help close the opportunity gaps that prevent many of our students from realizing their full potential. So I at LACO, I provide technical assistance and support to all 80 school districts to address, a variety of nutrition and wellness, priorities. And recently during COVID, our concern has been with addressing food insecurity, with the lack of access to nutritious food. So the next few slides, we're really going to highlight some of the resources that are available to you. So next slide, please. So I know all of our parents know the strong link between health and academic achievement. I don't know if you're able to see the next slide. There it is. So it's, the benefits of, health have been clearly established, and, all parents can speak to this. When your children are healthy, they're well nourished, they tend to behave, better, they have less behavior issues, they have less, they have more ways of, being able to concentrate and perform better in school. So there's really a strong connection between healthy behaviors and academic achievement. And we know that a lot of these behaviors carry into adulthood. So that's why it's even more important that while our children are young, that we try to instill a lot of the healthy habits that can improve, increase their health, both physically and emotionally. and decrease their risk of chronic illnesses later in life. And of course, it's been well documented that children that are healthy, they also perform, not only perform better academically, but they have improved attendance, they have improved attention span and concentration, and they're even able to score higher in standardized test scores. But I really want to emphasize that academic achievement is not only academic performance, but it also impacts, behavior, their social, emotional well-being, and this includes, depression and anxiety. As mentioned earlier, during COVID, many of our students are feeling isolated. We're seeing increased rates of hopelessness. And so the more reason that we try to prioritize their health and address the wellness issues that can have an impact on how, on their social emotional well-being as well. Next slide, please. So, we know, again, we've seen during COVID that many of our families do not have access to food. And this problem is particularly acute, as we can see from this chart. If we can see, the Latinx families and our Black families are at a greater risk of experiencing food insecurity. This was a problem before COVID. That we knew that many of our families had lack of access to food, to nutritious food, to support a healthy lifestyle. But even more so now during COVID, with school closures, we know that families are struggling with the loss of income, that families are struggling to have enough food and provide for their families. So this is where schools, again, can play a critical role in addressing this gap. So next slide, please. So these are just some of the food assistance programs that are available to all families. And we want to emphasize here that none of these programs affect immigration status. Okay, these resources are not going to hurt your immigration status. We know there's a lot of fear associated with accessing public assistance programs, but the programs that are listed here, such as WIC is, a food and nutrition supplemental program for pregnant women who have children 0 to age of 5. They qualify for supplemental nutrition benefits and they can receive nutrition counseling. This is a great program and it's evidence-based. It's been proven to really reduce the health disparities. Since we went into shelter in place, many of our schools have switched to a grab and go meal service, and they're providing free meals for all students. So this is regardless of their eligibility. If you identify an open site where they are operating a summer food program, you can take any children 18 and under to receive a free meal at the operating school sites. And if you have any questions, I would encourage you to contact your school site. I believe at your school site you are offering free meals, but you can go to any site that is convenient. You don't have to go to the school in which your student is enrolled. As long as you can find an open site, you can receive a free meal. And pandemic EBT, if your family has qualified, you should have received the pandemic EBT card. Over the summer, the pandemic EBT provided food benefits to eligible school-age children for the months of March through June. And recently, the pandemic EBT benefits were extended for the months of August and September. And those benefit cards are automatically being mailed to households in which they already received the pandemic EBT card. So if you have not received your card for the extended benefits, those are expected to be mailed out all the way through the end of this month. They have authorized the next round of pandemic EBT, but we do not have the details in terms of how that's going to be administered in the state. So stay tuned, and we'll definitely provide more information as soon as we have more details. There's a series of programs for seniors and adults that may be living with you as well. So if you're interested in those programs, feel free to reach out to me. And of course, I believe many of our community schools have been distributing food and providing additional groceries in addition to the school meals that you may be receiving at some of our school sites. But of course, there are food pantries, and then we have the Los Angeles Regional Food Bank that donates food as well. So those are resources that are available to you as well. And again, that's available to anyone in your household. And it, again, will not affect your immigration status. So I just wanted to pause and see if you have any questions before we move on to the next slide.
Mariam, I wanted to add the, like, on this new round of pandemic EBT, do you want to talk about the difference, like that it's also not just for school-age children, but for the little ones too?
Yes, absolutely. Thanks for that. Yes, for the next round of pandemic EBT, this was again approved, at the federal level. This is going to be in addition to the eligible school-age children. It will include their younger siblings as well. So this is new change that they're incorporating for this school year. So we are again waiting for the state to finalize their plan for implementation, but this is great that the benefits have been extended to the younger siblings that didn't qualify the previous year. Do you have any questions about any of the food assistance programs? Or please feel free to reach out to me after this presentation if I can be a resource to you. Thank you, and we can go on to the next slide. Thank you. And so with the CalFresh program as well, this is a federally funded supplemental nutrition assistant nutrition program, and you can get additional food benefits that will be issued in the form of an EBT card, and you have to meet certain income criteria in order to qualify. So CalFresh is one of the main food assistance programs that we have that allows you to buy groceries in the store of your choice. With you can purchase food at the grocery stores that accept EBT, and also some farmers market as well. Right now they really have simplified the approval, the application process, so you can apply online by going to getcalfresh.org. So you can visit the website, and if you need any targeted assistance, I'm sure our staff or we can connect you with eligibility workers that can provide more targeted assistance to you if you need any assistance in applying for CalFresh. And again, if you have any concerns with immigration status, just keep in mind that your children can qualify for CalFresh benefits. If they're, again, that's not going to affect their parents' immigration status if you apply on behalf of your children. So if you are eligible for CalFresh, again, the public charge test may not apply to you. So you have children who are U.S. citizens in your household and they do qualify, and we want to make sure that at least you're applying on their behalf and they're receiving the CalFresh benefits that they qualify for. And is there anything else that Carolina you'd like to add to this?
No, I think the next couple of slides, because I know we're going a little bit over time, but I think this is so valuable, and just to remind people that it's not just food; it's food that's gonna help your kids like stay healthy and stay focused, and for you also to have some certainty of where the next meal is gonna come from. So thank you, Araceli. Back to you. Talk a little bit about staying healthy.
Yeah, no, thank you. And I definitely want to be mindful of the time. And I think at a high level, I want to make sure everybody feels good about staying healthy and what it means to make sure what services are available to you, what you shouldn't fear around maintaining coverage and access to these benefits. We've seen a drop off of immunizations and developmental screenings as a result of school going virtual. So a lot of points in time when kids were going in for doctor appointments for regular checkups and vaccinations in preparation for the school year, with COVID and that not happening in the summer months, the screenings that are critical for younger children as well as their vaccinations have lapsed. And so we want to really make sure that you know what is available to you, what you have a right to access, what does not impact your status in the future, and you should and again access as you need. And of course we'll share legal information shortly around who you can ask on your personal case. Next slide, please. So we talked a little bit around who is, or what programs you're eligible for. These are the other categories, the additional categories that are considered qualified immigrants. Again, both at the federal and state in terms of the additional programs that are federal Medicaid, which I mentioned, MEDI-CAL, CALFRESH, and Section 8 housing. So again, really want to highlight that there are, additional protections by the federal and state on additional categories. Next slide, please. So one of the big factors that's created a lot of chilling effect for over the last 2 years, and certainly over the last 4, with the federal government and a constant threat and change to immigrant policy, was that it was having an effect on children's health, family well-being, the risk of detention and deportations. And so there was a lot of concern around, again, what information was protected. Any usage of collection of information is used strictly for the purpose of eligibility. And so we wanted to make sure here that you knew that it is a very small population of individuals that would actually qualify for an additional immigration test called the public charge. There was an attempt and a change to the public charge definition. And here you have listed when these factors go into play. So you apply for a family-based green card, or you have a green card and leave the U.S. for more than 6 months. So those are, again, trigger points for when immigration authorities would actually use this test. I think one other important thing around this is that it's not only the usage of benefits, but it's multiple factors that are taken into account by immigration authorities. So that's also really important. It's a list of multiple factors and public benefits, and not all of them. So for example, CHIP, which is the Children's Health Insurance Program, is not a qualifier, and there are others. So I want to make sure that I share with you all the resources that can help you determine whether this would impact you personally. Next slide, please. So I mentioned the trigger points that would cause, and this one's actually in Spanish, but it really is around 3 points when, as I mentioned, when you seek a green card and or you leave the country for more than 6 months. That would trigger immigration authority to initiate this test. But again, the majority of people do not even qualify for this change in immigration status, and therefore the population impacted is very minimal. Next slide, please. So how can you determine if this impacts you? As part of a group of organizations with a legal aid organization in San Mateo in Northern California, they created a texting tool. So you can respond to this texting tool. The phone number is here reflected. It is a 650 number. So if you do have limitations for accessing a Bay Area, different regional phone number, this may be a challenge. However, you can visit via the online portal the same guide, and it's essentially a yes or no tool that walks you through whether this impacts you or not. It's available in English, Spanish, and Chinese. And here are the 2 words that you would type in after you text this number, and you could go through the guide. You can also access it via the internet. The website is reflected here, and you can also switch back to English, Spanish, or Chinese to determine whether this impacts you. Next slide, please. You can go into the next slide. So as I mentioned, the resources and the system is available for you. As advocates, we've been doing our due diligence for many years to make healthcare accessible. There's a lot of work to still do, and a lot of recovery and healing over the last 4 years of the chilling effect of a lot of potential change. And so one of the things we really want to make sure that we remind you is that healthcare is a human right and that you do have access to safe spaces. ICE and California Border Patrol are not allowed into community clinics and hospitals. And so if you need, again, COVID testing and or treatment, if you're feeling sick, while you can technically go visit a clinic, you can find out through this clinic locator how they are now under COVID, managing their patients and how they're coming in. Many of them are offering telehealth, telephonic services, again, just to mitigate access to some of the concerns around social distancing and making sure people stay safe. Next slide, please. The other is to know your healthcare rights. I mentioned to you all, we have a right to health insurance. This a coalition and organizations that we work with believe it's a right to have healthcare. And so for us, it's important that you know what you have access to. Interpreter access is available. So here we share with you the portal in which you can learn more, and I'll share at the end. The Children's Partnership has created parent-specific bookmarks and or brochures in multiple languages. I believe it's up to 14 languages that you can access around your healthcare rights and where you can go and who you can call if you're having issues with accessing services. Next slide, please. And here's the other great thing about the state of California. We've invested in services as a state in partnership with legal organizations to provide one-on-one consultations for individuals, regardless of immigration status and ability to pay, to help navigate their own personal experiences. So I mentioned the tool that you can either text or go onto the website, and it'll tell you like yes or no, or speak to a lawyer. If it were to defer you to a lawyer, this is where you could check a legal partner nearest you, and we'll also share in LA County specifically. Next slide, please. Here is the information for the local LA County resources. LA County has an Office of Immigrant Affairs, and they oversee multiple issues. Also, LACO here and some of the staff reflected here are great allies and supports to help you navigate some of the questions you may have, and again, direct you to a legal partner. Neighborhood Legal Services LA is the counterpart to our San Mateo partner who worked with us on that texting tool, for example, that we continue to do presentations with. If you want to do a one-on-one consultation, we have a couple of other partners who are also doing pro bono, regardless of ability to pay, and that list that we had mentioned through the California State Department of Social Services is also available here. Next slide, please.
And
for us,
like I think it will be important because I know from the group there are some of you that have immigrated most recently, or like you have friends that have immigrated most recently. Some of you have been here for longer. But the reason why we tell you about these pro bono attorneys, or like low cost attorneys, is because in California specifically, there's a very large number of immigrants being defrauded by notarios, because too often they see them in their neighborhoods, and or maybe they use these services for like tax preparedness, for notarization services, and because in their countries of origin they are used to using notary publics for other issues, they will go to them also for legal services. So, but they are not authorized to provide legal assistance and consultations. So this is why it's super important that before you you decide to pay for any of these services, consult with one of the free attorneys that the state is paying for. So it's free for you, but they are being paid. It's just something that, culturally speaking, I know for some of our families, it's difficult to understand. It's like, well, if it's free, it's not good. So that's part of, what I wanted to bring up, that as part of knowing your rights, you have the right, like, it's not guaranteed by the federal government, but the state of California is doing what it can to provide you with an attorney for consultations on this particular issue, which is unique of this time. This was something that didn't exist before, so it's something to take advantage of. While Araceli comes back, I think because we're over time, we just wanna. Here she is. Okay.
Yes. So thank you. I think the next few slides, and we'll make them available to you all. It's really about the advocacy and resources available to you all, and where you can access information and resources on how to support your families and your neighbors on preparing for the future. Next slide. We don't have to go through all of them. I just want to flag for you that there is a website that the Children's Partnership, in collaboration with hundreds of partners since 2016, and then our campaign All In for Safe Schools really is about, regardless of immigration status, having access to safe and schools that provide the resources that are needed to have academic success. And so we want to make sure that you continue to navigate and access these resources through our website, and you can continue on. I believe if you all have any questions, we are here for you all.
Yes, thank you so much. I know it was a little longer than usual, but this is such valuable and important information. So right now, if anybody has any questions, feel free to ask it.
Thank you, Maritza. And I know it's it's a lot of information to process, but also, like, there's no test after this, so that's a good thing. You can go back to the slides and take it. You can go back to the recording. But yeah, if you use this opportunity, if you need any clarification, or if there are other topics that you think would be interesting for you, as immigrant families to hear about, we would love to know.
Yeah. Should I stop recording, Maritza?
Well, yeah, that's okay. Well, thank you.
Okay. Yes, thank you. Just in case maybe somebody. Yeah. No, I mean, we can still continue, but maybe if someone has a question, I want to stop recording in case maybe, so I'm going to stop recording, but please stick around. Just recording in case anybody wants to ask a personal question or anything. I'll stop. That's all.
Yeah.
Okay. But